hairy caterpillars. Now, hairy caterpillars can look lovely and friendly and cuddly, but please keep away from them, and especially children. Keep people away from hairy caterpillars and also their nests because of health problems they can cause. Now, there's lots of different types of hairy caterpillars. The one I'm really talking about is the oak moth, because these are toxic. The tiny hairs on this oak moth, they contain a protein that can cause itchy skin rashes and less frequently eye and throat kind of irritations and also breathing problems. If you do touch a hairy caterpillar, what will happen is the hairs will get injected into you. So let's say I had it in my hand and all the hairs will then end up in my hand. You've got to remove those hairs because that's what's going to cause the itchiness, that's what could cause the breathing problems, not only in us as humans but also in animals as well. So the best thing to do is use tweezers and remove each hair out of the way. That doesn't work. What you could try is rinse your skin under running water, allow it to air dry because you don't want to rub it, that's going to make it worse. So allow it to air dry and then get some double-sided sticky tape or tape of any description and just gently put it over the top and then pull it out and see if you can pull the hairs out that way. So tweezers or tape. You don't want to leave the hairs in, that is going to make it worse. And obviously keep an eye on that person's breathing. Just keep away from the nests that you might find in the oak trees, keep away from the procession. When they come down from the nest, you'll find them just going along the road or the path, wherever they are, in a long line in a procession all the way along. Don't go, oh, they're really sweet and pick them up. Keep away from them. Keep your animals away from them. They are very, very toxic. Let's talk about ticks then. Now, ticks are tiny little creatures that live in woodland and grassy areas. And they're particularly prevalent in areas where there's deer and other wildlife, maybe even sheep. What they are, they're a little blood-sucking insect. They will bite into your skin and suck your blood out. They will be very small to begin with, so they're very hard to find. But the more blood they suck out, the more they eat, the bigger they become. So they look a little bit like a big blood blister. And you tend to find them in warm, moist areas, so armpits, down the back of your hairline, your groin, right about those kind of places. Always makes me itch when I talk about them. And of course you can find them on your pets as well. Now the thing about ticks is they can carry a disease called Lyme disease, which is really serious for humans and also very difficult to be able to diagnose. Now if somebody does have a tick on them, and I get them on my dog quite a lot, and you might have seen them on your pets, but children and humans can get ticks on them, especially if you're walking around countryside areas where, as I said, this type of wildlife is. And we need to make sure we remove them very carefully, ideally with a tick remover. And you kind of put it underneath the blood blister and you twist and rotate 360 degrees. If you haven't got a tick remover, which you can just buy from any pet store, do sell tick removers, then you can use a pair of tweezers. But what you have to be really careful with is you make sure you take the head out. So you end up with a big blood blister and a head attached to it. You must make sure the head's out. Please also don't burn them or cover them with Vaseline or make them dizzy by spinning them around, which you might have heard some people do. Please don't do that, because what will happen then is that the tick will be sick and it'll regurgitate all its contents inside you. And that's what could lead to disease. So don't make them angry, remove them carefully and then put them in a freezer bag, seal it up or a container and keep it in your freezer. And you might think, why on earth would I do that? Well, the reason we do that is because if that casualty, that person starts to become unwell after a period of time, then that tick could be tested for Lyme disease. So it's always good to keep hold of that tick just so that it can be tested later on. You might also want to keep hold of that tick as well, so you can show to medical professionals that you have got the whole of the tick out, the head is there, because that is very important. Now prevention of course is always better than cure. It's always a good idea if we are going in the countryside, we cover up with long trousers and socks when walking in those woodland and long grass areas. And we always check ourselves and check our clothing and our animals for ticks on our return. As I said, they're quite hard to see to begin with because they're very small, but the longer they're on us, or the longer they're on a pet for, the bigger they get. Now Lyme disease is a serious illness in humans. It's characterised by flu-like symptoms, very lethargic and maybe aches and pains of the body. Now 50% of people with Lyme disease develop a classic bullseye type rash, which can appear on any part of a body. If a doctor can diagnose and treat Lyme disease quickly, it is possible to make a full recovery. However, it can also lead to being paralysed, to arthritis, to meningitis, and severe long-term problems. So if someone feels unwell after being in contact with a tick, make sure you seek medical help and take that tick with you so that tick can get tested for Lyme disease. Don't forget to hit that subscribe button so you don't miss out on any of our important videos.